Hi, my name is Jermon Hawk, and this is my INFM675 Capstone proposal for clinical transformation. What is clinical transformation? Clinical transformation involves assessing and continually improving the way patient care is delivered at all levels in a care delivery organization. It occurs when an organization rejects existing practice patterns that deliver inefficient or less effective results. It also embraces a common goal of patient safety, clinical outcomes, and quality care through process redesign and IT implementation. Clinical transformation, when being utilized in unification to a patient complete health history, or even thought about against a more extensive patient populace, like the patient information can be an exceptionally amazing asset in improving the nature of continual care. Now, with that being said, the clinical transformation includes evaluating and ceaselessly refining the manner in which the continual care of patient is conveyed at each and every dimension in the healthcare organization. Like there are like various upgrades that these organizations can take to improve their capacity to utilize clinical information to improve the patient results. Like for example, the information is not like constantly accessible in a way that encourage like simple access and announcing. So subsequently, all that information is not accessible in an electronic manner with discrete information components and like visually like checking on graphs isn't yet like a key method for determining clinical quality. So like the clinical transformation structure really depends on reaping and gathering learnings from these effective healthcare innovations in telehealth usage, which includes like discoveries from a scope of dependable electronic programs. Clinical transformation involves surveying and consistently improving the manner in which understanding consideration is conveyed at all dimensions in a continual care association. Through viably merging individuals, procedures, and innovation, clinical transformation happens over office, divisions, and medical fields of skill. And when you're thinking about clinical transformation, it's usually grouped into certain topics. One of the topics is what measures are vital and how are they characterized, and like, is it accurate to say that they are important to the association or are they driven by the federal government? And the other one is how would you address information significance, legitimacy, and access? Now you have countless of personnel has proposed that like the healthcare organization is starting to execute the tools expected to like make a domain that like cultivate like this certain clinical transformation. But the activity is like centered around like guaranteeing perfection and like the quality of patient healthcare. And the results that like each individual, each spot would be unfailing. Now, the reason why they do it in this way is because without the utilization of suitable clinical data systems to help like this information collection, as well as the relocation and like the data distribution to empower the consistent conveyance of like clinical services over different supplies and surrounding, it is stated that the clinical transformation will not occur. Research question, problem, and objective. What techniques are healthcare organizations utilizing to influence evolving innovations in the present healthcare environment to push transformation? In the clinical service IT, clinical transformation has been around for a long time, and it also came to mean like a wide range of things. Clinical transformation may concentrate on like vital targets. However, something that makes it incredible is that it actually unites individuals in the board, innovations and procedures, as well as administrations and visions. Like clinical transformation ordinarily springs from like the selection of one or further developed clinical data systems. And these systems may include like the EMR, your EHR, your CPOE, or even your CDSS. And also another one is like cooperative connection among the executives and the administration. Like any change plan, regardless of whether the board like the change are progressively constrained in nature, requires cooperative connection amongst the executive and administration. Like the change will just happen in association to the extent that the supervision is upheld and engaged by the administration. But along these lines, you also got the board and the administration as well. And the board and the administration must hold a typical comprehension of what comprises this clinical transformation. And that means like the board and administration also must comprehend that leaving upon the transformation methodologies, it need like progression help, it need individual assets, and like authoritative projects if achievement is to be like figured out. Like also the board and administration must welcome the characterized measurement require like a thorough methodology, including all parts of the association and not just the medical procedures. So that way, like the healthcare transformation activity does require like the utilization of explicit measurements to gauge its results. Research methodology. So like when you're dealing with this, like the safety of the patients really relies upon like the comprehensive plan and like the advancement of like healthcare IT. And like through this idea of structure or advancement is obscure and may without a doubt be like difficult to decide. So like the clinical transformation initiative pursues an imaginative and cooperative approach. And through this approach, it would like express the issues and distinguish obstacles to look into. It would like accumulate the proof to recognize like holes and like hindrance within the system, as well as investigate outcomes by breaking down and translating its discovery. Also, it will finish like arrangement by creating suggestions and tools and steer the selection through like broadcasting and actualizing proposals and instruments. So with clinical transformation, it begins not with an innovation plan, but like with the obviously verbalized vision like of the ideal end state. And with this idea, it may like concentrate on like the patient healthcare as well as client administration or even in other like numbers of different results and stuff. But however, the clearness as far as how the idea advances the association quit undertaking while establishing a framework for like imminent activity is very, very imperative. Now, um, through this, you need to have a program establishment. And by having an establishment, an individual can create another application functional with the intention just on its standard usefulness. And that the following dimension with a usage, like these medical clinics, can see like a more noteworthy advantage through arranging and organization of procedure changes. Research methodology continuum. Like a noteworthy project for like the healthcare service organization is that the choice encompassing the way to deal with these innovation organizations are like a basic establishment for progress. Like notwithstanding like time after time, like these methodologies utilized in arrangement activity is random and it does not utilize a philosophy structure or apply like proof-based norm. So therefore, like the clinical transformation is upheld with innovation that give persistent focused data to doctor and different medical personnel, and also the clinical transformation and the clinical procedure developments are the best work an association can embrace since it influence the very embodiment of the worth given by the medicinal service convenience framework. Data collection method. Like various strategies can be implemented to gather information on clinical transformation exam purposes. So like statistic congregational procedures for conclusion evaluation change along like a continuum. So one part of the continuum are measurable strategies and the other part of the continuum are descriptive techniques for material assembly. So like the measurable statistic collection techniques depend on like the regular reviewing and systemization evidence like accumulation tools that fit like different happiness sense into like foreordained response classes. But these techniques usually generate outcomes that are anything but problematic to outline. So like the information that like is collected during this strategy would be used like for the examination would be like a descriptive or quantitative investigation by means of like electronic survey. Now, electronic surveys are another and unavoidable developing system utilization of web-based studies. So through this, like the individual like accept like an email that would redirect them to like a secure website to partake in the survey. And like a research like this is regularly faster and less comprehensive. Now, also when utilizing a scope of assortment and adaptable techniques in information accumulation and research, like descriptive studies uses comprehensive depictions of like data accumulation techniques that are utilized to enable viewers to see precisely how the investigation accomplished the estimations that are important to like their methodology and pretty much their estimation principles. These are my reference in the end of my slideshow, and I hope you guys enjoyed it. Have a great day.